众朋友们，晚上好！欢迎您收看由凤凰卫视每周台为您带来的天天话题栏目，我是小诗。疫情爆发的这2年间呢，不少季节性流行病毒看似好像不那么活跃，但是呢，随着防疫措施的放宽，生活逐渐恢复常态，这些常见的病毒又重回到了我们的生活中来。Rsv 呼吸道合胞病毒就是其中之一，而且今年流行的季节呢，比往年来得更早。自10月份以来呢，感染人数一直在不断的上升，全美不少的儿童医院的床位甚至出现了饱和的情况。特别是对于5岁以下的婴幼儿来说，这种病毒的致病性更高。根据 CDC 的数据呢，美国每年有210万5岁以下的儿童因为感染而需要就诊，58000人需要入院治疗，甚至还会造成大概300名儿童的死亡。那爸爸妈妈们该不该担心呢？又能做些什么来预防呢？今天我们就为您连线医疗机构 Kaiser Permanente 的儿科医生 Dr. Henry Wu 来了解一下。We're seeing Rsv is surging and overwhelming children's hospital across the country, especially the spike in cases is at the early start of cold and flu season, and as COVID continues to circulate, which made a lot of parents worried about. So, first of all, what is Rsv? How common is it in children?
Yeah, RSV is the name of a virus. The actual name is respiratory syncytial virus. And it's a virus that affects the nose, the throat, and the lungs, causing a lot of different respiratory symptoms. It's actually very, very common. Most children have already had it by the time that they're 2 years of age.
Okay, but I saw that CDC data shows in the U.S., RSV sends an estimate of 58,000 children under the age of 5 to hospitals for treatment each year. That's a pretty high number.
Yeah, it's very, very high and very, very common. I think we're just seeing a record-breaking surge, and it's coming at a different time of year for us. And so it's creating a lot of issues with hospitalizations at this time. But yeah, we're seeing it a lot in infants, children, and even adults can actually get it. But the older you are, it tends to be less severe.
Yeah, you just said RSV is actually a pretty normal virus. And what do we expect RSV season in normal years? Is RSV seasonal?
Yeah, so in normal pre-pandemic years, we typically expect it from the late fall to the early spring months. But of course, this depends on where you're located in the country.
Yeah, and this year it began much earlier, just like flu, which we should be more concerned. And we have noted a rise of cases from last month, October, to this month, November, and it keeps surging. Why is there an increase now?
Yeah, there could be several different reasons. In the winter of late 2020 up until early 2021, we almost had no cases of RSV reported around the world. But today, some of the infected children with RSV are getting very sick because they don't have natural protection by their immune system, or they just were never exposed to other respiratory viruses that are similar because of the pandemic.
Yeah, not only for kids, for us, adults the same. Like you said, our immune system might not be as prepared to fight a virus after more than 2 years of masking, social distancing, and all the restrictions which offer protection to us. Okay, so since RSV is a respiratory disease, it targets the upper respiratory tract or the lower part.
Usually it targets the upper respiratory tract, and so you'll just get some common cold symptoms, such as sneezing, some fever, coughing, and nasal congestion. But in some infants, children, and adults, it can affect the lower part of the respiratory tract, so specifically the lungs.
Okay, so like both. So that means the virus can enter all the way to lungs through nose and throat, which can cause pretty damaging symptoms to the body.
So it really just depends on your risk factors. You know, we worry a lot more in the younger infants or, older adults, those with weakened immune systems or those with underlying heart or lung disease. So the virus will affect the upper tract or the lower tract, you're right, but it tends to affect the lower tract in those more vulnerable patients.
Right. And I think what most parents concerned is RSV contagious? How does it spread?
Yeah, that's a great question. It's very, very contagious, just like any other respiratory virus. And it spreads from one person to another, usually through some sort of direct contact through the saliva, the mucus, and through the nasal congestion.
Is it more contagious than COVID?
It's not known to be more contagious, at this time, but it is extremely common out there in the community.
But it's kind of like the way COVID spread. It can go into the air and stay there and get into people's body through eyes, nose, or mouths.
That's right, because respiratory viruses in general are airborne viruses, and when people sneeze, when people cough, those droplets can infect you through all of those ways that you mentioned.
Another issue people or parents cared about is, can RSV live on hard surfaces? Like when we touch something that the virus landed on, then touch our face or mouth, can we get sick easily?
Well, it actually can live on hard surfaces such as toys or keyboard, doorknobs for up to 6 hours.
Wow.
And even live on your hands, unwashed hands for up to 30 minutes. So that's why it's very important to wash your hands with soap and water, especially after you touch, a common high-touch surface like a doorknob. Before you eat, it's important to wash your hands with soap and water, or after using the restroom. Because again, this virus is very, very contagious, and it can be contagious for up to 3 to 8 days, amongst people.
Just have a good hygiene habits. What are the main symptoms of RSV in children? The reason I said main is because the symptoms might be different depending on the age or stage of the illness, right?
That's correct. And it also depends on if it's affecting the upper respiratory tract or the lower respiratory tract. So I'll just first mention some of the most common symptoms that we see. And the most common we see would be some fever early in the part of the illness. We can get a dry or a wet cough. There can be nasal congestion, runny nose, sneezing. Babies might be very fussy or very clingy to the parents, and there might be some poor feeding. The more severe symptoms, so this is when we get worried that there's a lower respiratory tract infection. Those types of symptoms, you may see them breathing fast. You might see severe wheezing. You might see them sucking air in kind of where their neck is, or you might see what we call retractions, which basically is pulling of the skin inwards between the ribs or just below the ribs. And in very severe cases, you can have discoloration of the skin. So you can get purplish skin around the eyes. You can get blue or purple lips. Certainly those types of severe symptoms, we want you to seek immediate medical care.
Okay, so most of the time, this virus only causes cold-like symptoms. However, for some babies, the infection can be dangerous. So not all the baby experience common symptoms like coughing and a runny nose. Is there any symptoms that happen to babies younger than 6 months only?
No, actually, there isn't anything very specific. So it can just look like a common cold. But for babies, I would say the only additional thing to pay attention to is their hydration status. So a lot of them don't feed well, and so what ends up happening is they don't make a lot of urine. So that's one thing to look for, is if all of a sudden your baby is not urinating as often as before, and it's been very tough to feed them, that might be a early warning sign that something more severe is happening to them.
Okay, why it's very severe for like baby, or the younger they are, the more higher risk they are? Why is that? Just because babies' airways are smaller than us or bigger kids?
That's actually exactly correct. So for infants and children, generally less than 2 years of age, the airways are much smaller. So if you think about, the tree trunk as kind of our airway, in babies, it's like the tiny little branches that come from other branches. They're very, very small. And so when the virus causes inflammation of those airways, you get some swelling and you get some liquid around and within those airways, making air harder to pass through those tiny, tiny branches of our airway. And that's what leads to kind of the difficulty breathing.
Yeah, so it's possible that RSV can lead to serious medical conditions that can be life-threatening if left untreated. So parents, if your baby or toddlers have any of the symptoms Dr. Wu just said, then you should go to ER or see your pediatrician immediately. Even if your child has a mild case, it's best to talk to your doctors to make sure their symptoms aren't serious. Okay, so how long does it take for symptoms to show up, and how long does the illness generally last until fully recovered?
Yeah, a person can be exposed at any time. Symptoms usually start about 2 to 8 days, I would say, following contact with RSV.
Okay, so since the RSV symptoms are like flu symptoms, as you explained, I don't think it's easy for parents to tell the difference between these two illnesses. Can parents do rapid tests at home for their children, like what we do now for COVID? How is RSV diagnosed?
Yeah, unfortunately, rapid antigen tests are not readily available in the community. And actually, rapid antigen tests, even though we have them, they're really just reserved for infants and children who are severely sick, sick enough to get hospitalized. And luckily, only 3% of cases end up hospitalized. And the majority of these cases, the infection gets better on its own. And because there is no treatment and it tends to get better in a majority of cases, we do not recommend kind of routine testing or testing for clearance, even though, yes, that test is available.
Yeah, especially for healthy kids, it's not necessary to distinguish RSV from a common cold.
That's right. And so, again, most of the symptoms that we see are fairly mild, mainly in the upper respiratory tract. But if you have any concerns, especially if your child is not improving after about 7 days of illness, if you have a prolonged fever of more than 2 days, it is important to, call your doctor and, they may bring you in so that they can do a physical exam and a more thorough checkup to see if you have any signs of more of the complications of RSV.
The reason I asked about testing is because I think treatment for things like flu and COVID may differ. Then how is RSV treated? You already mentioned there is no specific cure for that, right?
That's correct. So there's no cure for RSV, and we treat RSV symptoms through home supportive care in most cases. So if it's okay, let me just share some things that may help families at home with young ones with RSV. So one thing is fever is very common, so you can use acetaminophen. Ibuprofen can also be used in those 6 months and older. Using gentle suctioning after using some saline drops or saline spray can help clear the nose. And this is especially important for babies who might be breastfeeding or bottle feeding. One great tip is to suction before they're fed so that they can have the nose clear and feed a lot easier. So again, it's a lot of this supportive care. A cool mist humidifier can sometimes help break up the mucus as well. For older children, more than 1 year of age, you can use honey and lots of liquids to allow them to swallow some of the mucus, because children aren't good about blowing their nose or coughing out their phlegm. So you want to help them by swallowing some of that mucus through the use of the honey for them.
Okay. So it's like a matter of managing symptoms and letting the virus run its course. But for severe cases, again, parents definitely should bring their children to ER or see a doctor immediately.
That's right, especially if you see those signs of breathing difficulty. We don't worry so much about the cough, because the cough is actually a good thing. It's them trying to break up the mucus and cough it out. But if all of a sudden they're breathing faster or harder, their skin or lip color changes, really poor feeding leading to dehydration or poor urination, those are reasons to definitely seek more immediate medical attention.
Right.
And you kind of brought this up. There are no medications, unfortunately, for RSV. Steroids and antibiotics will not work against this virus. In the very small number of cases where we have to hospitalize a baby, they'll sometimes get some oxygen therapy, IV fluids as well. It's very rare for them to need the intensive care unit. And most will go home after 2 to 3 days of this supportive care when we're kind of getting them through the most critical part of the infection.
Got it. So for COVID, we have already known that people can get it twice or even multiple times because of different variants. As for RSV, can children get infected twice?
Yes, you can. So infants, children, adults, you can get it multiple times, even multiple times in one season. But thankfully, most symptoms are like the common cold. And after you get it once, your body is better able to recognize it and fight it off, so it's less severe the second or third time you get it.
Okay. So is there a vaccine like flu shot available to get every year for RSV?
Unfortunately, for most people, there is no vaccine, but there is one, for specific high-risk patient populations.
Okay, but we're seeing some pharmaceutical companies like Pfizer and Moderna are developing a combined vaccine for flu, COVID, and RSV, which is pretty easier for everyone, even though it's in early stages, but still looks promising, right?
Yeah, we're hopeful. I mean, that would be something that would really help out, especially for the higher risk group patients, in order to kind of prevent complications from the infection.
Right. You just said some premature infants and children with underlying conditions are high risk for complications. You said there is a drug to prevent severe RSV as preventative care during RSV season?
That's right. So it's known as Synagis, and we've had that for a while. This is a vaccine that contains antibodies to fight the virus, but it's really only used in infants who are 6 months and younger at the start of RSV season, and those who were born basically very early, so 29 weeks gestation, or those who have had chronic lung disease because they're premature. So it's really reserved for a very specific group of infants.
How many shots of it?
So you usually get 1 shot per month. And if, for example, the season lasts, 5 to 6 months, you may get a shot up to 5 or 6 times just during the whole duration of the RSV season.
Okay, so to be clear, it's not available for everyone, just for those babies who are most vulnerable, right?
Most vulnerable, again, prematurity is the biggest group. We also have infants get it who have severe congenital heart disease, severe lung problems, or those who are immunocompromised, meaning they don't have an immune system to fight the virus naturally.
Right. And there is no specific cure to treat, no vaccine to prevent. Then what can parents do to stay away from this virus? What do you recommend?
Yeah, so hand hygiene, washing your hands for 20 seconds with warm water and soap, that's very, very easy to do. And it really can help minimize the spread of RSV. For children interacting with a lot of toys, you can sanitize the toys. You can clean different surfaces that are, common high-touch surfaces like doorknobs, for instance. You want to avoid crowded indoor spaces, if at all possible, or limit kind of your exposures to that. And certainly try to avoid contact with people who are sick. For parents with young babies, we really recommend kind of limiting some of that contact, or making sure that the other person is vaccinated and has already kind of washed their hands before kind of holding the baby, for instance.
Yeah.
So a lot of this stuff we're experts at now because of the pandemic. So we definitely want to make use of this also while we're seeing these other respiratory viruses.
Yeah, things like that can help to probably not eliminate, but at least decrease the possibility of exposure to the virus. Okay, so now we know the virus spreads easily among young children, especially in daycare or school settings, just like other viruses, because they share toys, like you said, they play closely together, and you can't ask children to wear masks all the time by themselves or keep them have social distance. It's just kind of impossible. But we still can teach them like cough and sneeze into a tissue or into their elbows rather than their hands, things like that, right?
Absolutely. So you bring up just a great idea, teaching your child to sneeze or cough into their elbow or cover it with a tissue. That's going to help prevent the spread and minimize those airborne droplets in the air.
Right. Another thing just coming to my mind, I think worth to mention is, a lot of parents would like to give, I'll say, affectionate kisses to their children, but it might be dangerous to them now because adults could be asymptomatic. We don't know we're infected, but like you said, it can be a life-threatening to younger children, especially people from outside the household.
Yeah, I mean, we're certainly not saying don't give your children kisses or anything, but it's just being mindful and aware of those who are interacting, with your children. Certainly if you're really sick and showing symptoms, you have a high viral load.
Yeah.
So we definitely want to limit exposures during that period of time. But yeah, like you said, it's impractical to sometimes keep children in childcare centers away from each other, but there are some simple things that we could still do on a day-to-day basis to just kind of minimize and control the spread.
Yeah, not just for RSV. I think it's just better not to kiss infants, especially premature infants, frequently, because as adults, we have stronger immune system, and we don't know if we carry some kind of virus for the time being. It might be nothing to us. Like you said, we have stronger immune system, but it might be a risk factor to children, right?
Right.
Mm-hmm. There are tons of ways to show love. Just save your kisses for now, parents. We can help prevent the spread of RSV by following good hygiene, as Dr. Wu just mentioned. And then another point is, I think we should get vaccination updated, which include flu shot and a COVID booster.
Yeah, and it's just to protect you and those around you from catching something else. While all of these different respiratory viruses are circulating, we're calling it, this triple threat. There's COVID,
right,
RSV, influenza, and so many other viruses just during this time. And with all of the pressure in the hospital setting and limited bed space, we just want to do what we can to limit the spread.
Yeah, we don't want a triple-demic. Is that a word? With flu, COVID, and RSV, it's just too much for us for now. Thank you, Dr. Wu, for your time and all the explanations. We're looking forward to talking with you again.
Thank you for having me.
那也非常感谢电视机前观众朋友们的收看，我们下期再见，祝您晚安。
您正在收看的是凤凰卫视。